need to understand about the morbid pulse. Morbid is nothing but it is the toxicity or where the blood vessels are there. Through the blood vessels the blood flow properly. When the blood flow is not passing properly, that means the entire artery, somewhere the movement is good inside the blood vessel, the blood flow is good, then you understand that is properly functioning of the internal organ, that blood is supplying to that organ. When somewhere that artery get obstructed or the artery get problem, that is a insufficient blood flow to that particular organ, so that time it causing the problem which reflecting on the radial artery. We all know that because each and every organ that is reflecting on the radial artery as per the traditional medicine. If there is the internal problem is there, that problem is precisely reflecting on the radial artery. Because why is it only radial artery, not other arteries? Of course, so many arteries are there in our body. For example, is the carotid artery is there. On the carotid artery, we can diagnose many diseases. At the same time, we understand this the posterior tibial artery, dorsalis pedis artery, peroneal popliteal artery, femoral artery, so on is existing. But in that which is more accessible and readable, palpable is on the radial artery. Placing here is not so good. If somebody girl is there, so placing the hand is not really good. And radial artery of course is the superficial artery and also prominent artery which is existing on the wrist region. So therefore this is really good. Otherwise we can see the brachial artery which is located on the pericardium 3. Pericardium 3 region. I am audible in the Zoom? So you can hear me, all of you? Please comment. ಕೇಳಿಸ್ತಾ ಆಯ್ತಾ ಝೂಮಲ್ಲಿ? ಹಾಂ ಕೇಳಿಸ್ತಾ ಆಯ್ತಾ ನಿಮಗೆ? ಓಕೆ. ಹೌದೌದು, ನನ್ನ ಮುಖ ತುಂಬ ನೋಡ್ಬಿಟ್ಟಿದ್ದೀರಾ. ಇವಾಗ ಜಾಸ್ತಿ ನೋಡಿದ್ರೆ ನಿಮಗೆ ಹಾಯ್ ಅನಿಸೋದಿಲ್ಲ, ಮತ್ತು ವಾಂತಿ ಬಂದುಬಿಟ್ರೆ ಕಷ್ಟ. ಅದಕ್ಕೆ ಇವರು ಫಾರಿನರ್ ಒಬ್ಬರು ಕುತ್ಕೊಂಡಿದ್ದಾರೆ ಇಲ್ಲಿ. ಅವರು ಏನು ಇದು ಮಡಗಿದ್ದಾರೆ ಕೈ, ಅವ್ರಿಗೆ ನೋಡ್ತಾ ಇರಿ, ಸರಿನಾ? ಸರಿ, ಅವ್ರಿಗೆ ಅರ್ಥ ಆಗ್ತಾ ಇದ್ರೆ ಸಾಕು, ಸರಿನಾ? ಸರಿ, ವೇರ್ ಐ ವಾಸ್ talking about the radial artery. Yes, pericardium 3 is the place where we can see the brachial artery pulse. It is existing or not, but however without any much confusion we try to analyze and understand about the radial artery. Right, radial artery, once again I'll repeat to assume and keep it in your mind, so that in future it is very super simple. Whenever you wanted to see that, the organ should reflect on that particular region. Now when we lift the hand, so in this way we need to understand. So this is the first pulse, red color. So when this is the first pulse, where we can see here, this is from the wrist crease. From the wrist crease, it's okay, this also good. And this is the second pulse, and this is the third pulse. Now we understand this second pulse is a styloid process. First we try to find out is a styloid process, is a theoretical part, nothing to worry about it. First is the wrist crease. Where is the wrist crease? This is the below the thenar eminence of the palm, where this is the ventral side of the wrist crease, right? On the thumb side, not on the ulnar side, right? So now we understand exactly next to the immediately crease. So below that crease is the segment called as a first segment, or we call as a distal pulse, right? So this distal pulse we can consider as a proximal as well. This is the middle pulse, and this is the proximal pulse, and this is the distal pulse, and some authors write this is the distal and then this is the proximal. Nothing much difference, but we understand is the first segment. First segment pulse are located to the upper cavity, right? There are the three divisions in the pulse. The first division is from heaven, human, earth. The first segment to be known as a upper cavity, the second segment to be known as a middle cavity, and the lower segment or the last pulse to be known as a lower cavity, pelvic cavity. The whole body is divided into three segments. The upper segment is the above the chest, right? You understand precisely, you wanted to know two theories, I'll tell you, keep it in your mind. So exactly this is called as a Tian Chung, Tian Sang. So that is known as a chest cavity in Chinese, right? So this says Ren 22, Tian Tu. From here to Shen Sang, that is the Ren 17. In between this place is executing on the first radial artery, right? So that means some of the theories says that from the chest cavity, that means Ren 17 above, from the top of the head to the Ren 17, that means in the center of the nipple, from here to top to be considered as a upper cavity. That means is the upper part of the body. Now that upper part of the body, what are the organs are located? Lungs and heart is located. Now as of now we will take it, when we take it as a right hand to be taken as a right side of the lung, and the left side to be taken as a left side of the lung, or precisely the right side to be considered as a lungs only, right? So now we understand this part is lungs, right? Sometimes if super level we wanted to understand, that's called as a, some people who do have the heart is on the left side is located, some people congenitally right side is located. So in that case, when the right side is called as a dextrocardia, levocardia, mesocardia, there are the three divisions. So in that is the dextrocardia is nothing but, so which is located maximum on the right side than the left side. In this case, we need to understand that particular time the pulse is on the first division is heart, and the left side pulses to be known as a lungs. Okay. Now as of now for her is right side lungs only, assume her heart is on the left side only, right? So otherwise once we take the X-ray, in that X-ray it shows right side is very predominantly captured the heart in the position of the lungs. In that case we understand heart is located, but without any much complication, that heart is located on the left side normally, but very few congenitally will affected on the other side. So now we understand the first pulse is the lungs pulse. We are talking about the right pulse. Then we understand about the left also simultaneously, so that the upper cavity will come to know. Right. The upper cavity now is the left side is the heart, right side lungs. Is it clear to all of you? Yes, right. Sir. Now we'll come to the next position. So next pulse, there is a one place is there. Immediately we place to the second level without any gap. In between the first pulse to second pulse, there is no gap in between. So therefore, this is called as a which cavity? Middle cavity. What are the organs are located?
Stomach, liver, gallbladder.
Excellent. Now the right side pulses to be considered as a spleen and then stomach, and the left side pulse to be known as a gallbladder and then liver. Right? We understand as of now is the in organs. One is the lungs is the right side, left side to be known as a heart, and then the second pulse to be known as a spleen and as pancreas, and then the left side to be known as a liver, right? And the down position to be known as a kidney yang. Down position to be known as a kidney yang. The left side position to be known as a kidney yin. So you assume the kidney yin and yang. We don't want to get much confusion, but here we can consider the left side to be known as a brain, right? Left side to be known as a brain, right side to be known as a kidneys. Right kidney and then left kidney, there are the two different. Right kidney, this is the left kidney, and this is the right kidney, the root of the life or the root of the kidney. So this is located here, like that we can assume. But however, rather than getting confusion, because according to my clinical experience, but left side that to be considered as a brain, you assume. No pericardium, left side, right side. Right side to be known as a brain on the last pulse, and then this left side to be known as a kidneys. Right? This is the kidneys and this is the brain. Sir, brain is on the top, but why is it so in the lower direction? But here itself also we can consider that, I will tell you later. But this is according to now I integrated the Chinese philosophy and then Korean philosophy together. I integrated. Now the Korean philosophy says this is the brain and spinal cord, and this is the Chinese philosophy says this is the kidney yin is the proper kidney, and then this is the kidney yang. But kidney yang to understand and recognize, it takes longer time to you, but however that is not necessary as of now. We understand the first upper geo is called as the heart and lungs is located, the middle geo is the spleen, and then pancreas and liver is located, and the distal topmost down, that is called as a kidneys are located. And then if we wanted to understand further, then we understand how the lower geo, what are the organs are located, intestines are located, and then uterus and then para or fallopian tubes, testes, ovaries and all located. So for which we understand this is the lower pulse or the third pulse to be known as this pelvic organs also located under that. Intestines are located there but not located on the surface level of the first pulse. So we all know now we understand. Do you have any doubt on it? Everybody is clear, right? So first pulse is.
Why is it that we are taking the liver and gallbladder on the left instead of on the right?
Yes, exactly.
That position is vice versa.
Yeah, vice versa. That's taking as a vice versa. Yeah, because that is proven that the liver and gallbladder is majorly reflecting on the left radial artery. So that is when I take the liver meridian, that time I will tell you so many lungs are located only on the right and the liver is located only on the left. According to the Hara diagnosis is there. So that diagnosis is called as abdominal diagnosis. That also to be considered, liver is located not on the right, liver is located on the left side of the pulse. Physically and then anatomically located on the right side, but here is we understand this is specifically located on the left side of the pulse itself, right? So now another theory, when we understand about the further deeper level, either you can see right or left, but both the pulses, here is the spleen, but here also consider as a liver. Here is the liver, also consider as a spleen. When we go for the advanced level, then I wanted to tell you as per this, there are the Ayurveda says that is the Vayu, Pitta, Kapha, VPK pulses. So those pulses are related to any one hand you just selected. This hand also Vata, Pitta, Kapha. This also Vata, Pitta, Kapha. Right. So now all the three segments only they select, but they understand what is Vayu, what is Pitta, what is Kapha to understand about the pulse positions, right? According to their perspective, we understand there is the Vayu pulse, the first pulse to be known as a Vayu pulse, the first pulse to be known as a Vayu pulse. So Vayu is indicating over here, when to understand this really is the Vayu pulse is there, or the normal pulse, rhythm and then force, tension, volume is same. Now once they place like this, then you understand there is the snake is or the cobra is moving. When the cobra is moving in this direction, and that indicating is the Vayu problem is existing, right? So based on that perspective, when you assume that the snake is moving very rapidly and then quickly, right? So that indicating there is the Vayu pulses are existing, then it is the lungs and then liver both also affected, right? When you come to the middle pulse, so that pulse is indicating here is the called as the frog pulse. So frog is jumping each other, every time they jump and then move to the position. That means is the very rapid pulses that also, and it is a very strong pulse. So that indicating is the excessive pitta is accumulated. That means excessive heat is accumulated in the liver. In terms of here, that liver is more predominant on that particular region. So that indicating the excessive heat is there, not only in the liver, of course, with including the liver, that also affected to the entire body, also having the pitta is more, and then liver constitution is more, and body temperature also more, and then internal visceral environment also getting more predominantly is affected. Then you come to the third position is the kapha pulse. When you press this, when the kapha pulse is indicating, there is like a water, that itself is the water pulse. The water is moving nicely, waves how very slowly the river is moving. In that way that flows on the river, you can see there is a swan. The swan is swimming. The swan is swimming smoothly. So that kind of the sensation is there. So that indicating there is the kapha pulse is there, right? So if there is a normal rhythm and then force is there, that to be considered as a normal. When any abnormality we have seen anywhere on these three places, that also to be considered as these are the three morbid diseases or the morbid diagnosis which is reflecting to that. The kapha again, it is indicating to two elements or the organs. So one is the spleen, the other one is the kidney. So kidney and then spleen are role which causing the kapha, and right, and also accumulation are due to indirectly that will affect on the pulmonary system, especially on the lungs. So now we integratedly see this is three pulse. Keep it in your mind when you wanted to diagnose the patient. One is the according to the Ayurveda, also keep it cobra or the snake. Sir, we have seen in the very long distance, and it's moving. How it's moving? It doesn't move in the straight manner, but that moves in the zigzag type. Exactly that pulse also same, right? The pulse also moving like this. The snake also moves in the same direction, right? So that indicating that pulse is vata pulse, right? Then the pitta pulse is jumps. One place is very it looks seems to be. Now for example, see, this is the pulse. This is the pulse. Now this pulse is a snake pulse. How it will reflect? So the pulse is like this, right? When this pulse is a snake, which we call as a pitta pulse, is jumping. That means rapidly, accelerated, forcefully it jumps. So that indicating is the pitta get excessiveness. Of course, when during the temperature, high temperature is there, during the temperature also pulses are very rapid, accelerated, right? And then the another pulse is like that swan pulse, to be known as a swan pulse is known as a swimming. So who can't sit? Madam ಕೂತ್ಕೊಳ್ಳಿ. Madam, you also sit. ಇಲ್ಲ ಕೂತ್ಕೊಳ್ಳಿ. Still I start this. You also sit, please. So this is like a smoothly moving pulse, right? So that kind of the movement is indicating to the kapha pulse. Yes. ಬಂದ್ಬಿಡಿ, ಫ್ರಂಟಲ್ಲಿ ಬಂದ್ಬಿಡಿ, ಮುಂಚೆ ಬಂದ್ಬಿಡಿ ಎಲ್ಲರೂ. And we understand the quality of the pulses. See, here is just I am giving you as a theoretical part. That's not quite enough, but still theory again I wanted to give you. One is the why we wanted to see the pulses again and again. Internal parameters, frequency, movement of the blood, movement of the chi, movement of the su is nothing but is the blood, movement of the body fluids, whether it is a dryness or the hardness, whether is the moisture is there or not there, or there is the congealed is there or the exuberance is there. Congealed means is the coagulated, exuberance means is the full of the pulse is there, or there is the dilemma, pulses are there, or making the confusion or exactly the ambiguity. So all are connected to something. Is the pulse itself is really super simple most of the time. Sometimes it's a very difficult to analyze the pulses as well. Sometimes it won't reflect on the radial artery, but however short pulse, long pulse, slow pulse, rapid pulse, accelerated pulse, knotty pulse, knotted pulse, hasty pulse, right? And then we call as a slippery pulse. So many pulses are there, but in that pulses now we have to see each and every pulse, what type of the pulses are existing. Each and every pulse we should see what quality of the pulse are existing. So that's important. So how will going to happen? This is slow and steady. When we understand the normal, which I told you previously, keep the alarm clock next to you where the seconds also is there. Through the seconds, first don't see any kind of the patient pulses as of now, and who are seniors and studying for the last couple of years, people can see. Apart from that, so you try to see only what are the normal pulses in 15 seconds, 30 seconds and 1 minute. If you are perfect to understand, even I can place, normally I'll tell you, I don't see in the thermometer about the temperature. I never seen, I don't want to see also. Perhaps 1 or 2 times I have seen in the beginning stage, but normally the people come for the temperature. I just place the finger, I just mention 99 degree, you have the temperature. 100 degree, you have the temperature. 101 degree, you have the temperature. By placing that itself, we analyze that yes, you have the temperature. But what is the level, that also we can tell as per the rhythm of the pulses. Rhythm is the rate and rhythm. That means every breath, how many beats? 4 beats. Every breath 4 beats should be there, right? In this way, otherwise every 15 seconds, how many? Minimum 15 to 20 pulses should be there. But that if it is more happening, duck, it's happening like a rapidly pulses are coming, so that indicating excessive fever or the temperature or body heat or pitta is there, which is reflecting is the problem, right? So in that perspective we understand about the, just we place the hand. Now I am coming to the practical section. You just everybody listen carefully so that you can implement. Now I am placing to the first pulse. Just I am placing, not pressing. Remember, just I am placing the finger. There is no, only I can feel the palpation, because energy cannot be seen and cannot be measured. Only palpate. So I am just palpating and finding the pulses. So I can feel the superficial pulse is normal, and then I come to the second pulse to be known as a stomach pulse. This is in fact, assume it is the large intestine pulse. According to the theoretical part, this is the large intestine pulse. The second pulse is the stomach pulse, and then the third pulse is triple warmer pulse. The third pulse is triple warmer, sangio, or the cavities, or the spinal cord, or the brain, right? So I place it 3 places. Now I can find somewhere is some imbalance, but however I need to recheck. Minimum how many times we have to place on each pulse? At least 10 times, 10 beats should be there. So now I place it 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. In one rhythm flow is there. I come to the stomach pulse 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. I come to the third floor, third pulse. I can't see any more pulse. Third pulse I can't see. Now there are the few theories are there. So theories, it says that we have to place first is on the styloid process. First we have to place it on the styloid process of the radius bone. First we have to place it. But however, that getting slightly confusion, but you make sure which finger is the good sensitive to you. If the sensitiveness is there on the tip of the finger, you can palpate, then you can palpate. When we don't feel it, when this is roughness is there on the tip of the knuckles or the belly of my finger, but this is something is roughness is there in the girls and women especially, they do. There is no work for them, right? And they don't do any work. And despite of that, they will get very hard on this surface. So that particular time, so you just place, you feel it's not comfortable with this finger and use the middle finger. If the middle finger is not comfortable, use the other finger, right? Third ring finger. So in the similar way, either 3 fingers you can place it in one level, otherwise you can place it one by one also. In my clinical practice, I made in the different concepts by using 1 finger, 2 fingers, 3 fingers. According to my convenient, I see the pulses. But basically for you teaching in the both the ways I will teach you. Now I wanted to place on the styloid process, middle finger is the first. How the styloid process, all of you find out, you touch and feel the bone. You touch and feel the bone, this is a styloid process. You touch and feel, this is the styloid process of the radius of the bone, right? So anterior to that, front of that region where the artery get pop up, there you need to place it. Only placing is your job. Only placing is the job. Now I placed 3 fingers together and then I understand, yes, okay. But initially what happened, because at a time seeing the 3 pulses, sometimes you feel difficulty, right? Normally I place like this and I see all the 12 pulses at a time. That's in the short period I wanted to finish the diagnosis. I just place and then I do diagnose, then I'll wind up. But everything is there in the mind, which is excessiveness, which is deficiency. That it for you, all of you takes time. To which is low, which is high, that and all you need to write down. You have to monitor on the paper. Otherwise, it doesn't enter to your mind. So now one by one is really good. Rather than placing 3 fingers, then 3 beats are getting, or 1 beat is getting, another 2 beats are not getting, then which one is correct you may not know. So therefore place it one by one and then write down, yes, first pulse is when the lungs I told you, then the superficial pulse, and then middle pulse, and then deep pulse. There are the 3 pulses normally seen, but 3 pulses again you forget about the middle pulse. That also get confusion, right? Only 2 pulses you can see on the one particular segment. So that area is the first pulse to be known as a, understand, that is large intestine pulse, that's called as a superficial pulse, right? Because the lungs is connected to the large intestine as per the theoretical part, so that's the reason we place the large intestine pulse. So it is signal is getting, that means pulsation is there, that to be considered as a normal. Then you move to the second pulse, is the stomach pulse. The stomach pulse is the superficial pulse, not the deep pulses, right? So once I place on the triple warmer pulse, So that pulse I can't see it. Now this is diagnosis on the superficial level. Write down, triple warmer pulse is weak. Now tell your name please. Nagamani, triple warmer pulse is weak. Now I go for the deep pulses on the same hand, right? Now I just give the pressure, deep pulses. I can feel that pulses are normal of the lungs. I just move to the second pulse, that's the spleen, and then stomach, pancreas is normal. Then I move to the third position, the pericardium pulse or the brain pulse is functioning well. I think over functioning to her. Okay, right? Now 3 pulses we have seen. So one is deficiency. What is deficiency? Triple warmer is deficiency. Now I just move on to the left hand. I just place the finger on the first position. So small intestine pulse, which I told you is the heart. Heart is the another coupled organ is small intestine and heart together. Right now small intestine pulse is normal. Then I just move on to the second division, that gallbladder pulse. The gallbladder pulse also reflecting well. Right? The small intestine is normal. That means is the more, and then gallbladder is okay, correct pulse. Then I just move to the urinary bladder pulse, UB pulse I can't see here. Urinary bladder pulse, then the deep pulse to be known as a kidney pulse. Right. Now the urinary bladder pulse is deficiency, then the kidney pulse, I will go to the deeper level. This the kidney pulse is normal. Then I go to the middle pulse, then the liver pulse also normal. Then I will go to the first pulse, then this pulse also to be normal. Now when I am teaching you or when I am seeing the pulses, so that particular time place the pillow. Under the wrist you just place one small wrist support, and then you just analyze and see. When we are seeing that particular time, we shouldn't speak or she shouldn't speak. So that means when I am talking and then listening is also not good. When she is talking and telling her complaints, also not good. Right? When I am also seeing without talking, she also should sit comfortably without moving the heart upward direction. The hand should be below the heart, this shouldn't be upward direction. Right? Now we have to place it very precisely below the heart region, and then you can see step by step, one by one. I'll keep silent for a minute, and then I'll see the pulses. You also keep silent. Then I need to recheck whether I checked is the normal pulse or the abnormal pulse. Now I have seen, this is I diagnosed as per the pulse diagnosis, and I think Nagamani first time I am seeing her pulses, and just you open your mouth, bring your tongue outside. Yeah, this is quite enough just for the clarity about it. But now we understand the majorly she do have the problems connected to the two things. One is actually excessive heat is there within her, and the second is she do have the cervical pain and then is headache, and because of this triple warmer energy is weak. Due to this weakness she will get the problem related to the neck, related to the shoulder, related to the head region, especially this region where on the behind your ears, and once we give the pressure you feel more tenderness, especially on the feng chi point, that means is the gallbladder 20 area, you feel more pathetic pain once we give the pressure. Otherwise also sometimes you will get this kind of the pain. So due to this reason, because the triple warmer is communicating to the nervous system as well, when the nervous system is partially affected, also you feel the numbness. Also you feel the fatigueness. Also the people prone to get the thyroid related disorders, perhaps she don't have, she may have. If she don't have, we are not predicting, chances are there to get into that or may not be possible. But you don't get phobia that, so you will going to get that thyroid. So this is one thing. The second thing is, now I diagnosed the triple warmer here, but according to the Professor Park Jao. Whereas in come to the other level, which I understand this is the lower geo or the lower cavity. She do have lower cavity is connected to the intestine as well. Lower cavity is connected to the colon. So now the colon related problem also chances are there, the bowel movements are not up to that mark, which reflecting the problem in the colon as well. Now we understand about this, right? Now I come to the other part of the organ. Now we understand the vesical organ or the urinary bladder pulse is weaker than the normal. So when the UB chi is the deficiency, the UB chi deficiency, you understand, there is the back problem is chances are there, certainly she will get the back pain as well. Right. Once the back pain is there, then you understand urinary bladder weakness, which is reflecting on the lower geo, and also is the back pain. Urinary bladder also connected to the bone system. Kidneys are connected to the bone. So therefore, when the bone's stamina also more or less is lesser than the normal, where could be the reason to cause the knee pain and then back pain and then joints pain, so on. And now you understand related to the pelvic geo, uterus. So uterus related problem perhaps is the leukorrhea, that means is the white discharge, and dysmenorrhea. Anything connected to that, chances are there. Now I understand urinary bladder is weakness is there, UB weakness, which is the mother for the urinary bladder, that is intestine. UB mother is intestine. When the intestine energy is not passing to her, so which leads to the problem connected to the pelvic geo as well.